as well, of course, as our organization, PAHO. We have a lineup of great and dynamic speakers, as well as country representatives for today's webinar. We'll be starting with welcoming remarks by the organizations here represented, also by European Union as well. So let me mention our first set of speakers welcome who will be providing the welcome and opening remarks this morning. First, we will be having a recorded message by the Subregional Program Coordination Director, Mr. Dean Chambliss from PAHO. Next, we will have Leah Marchuk, the Director of Inter-American Affairs for the Government of Canada. And in the third person in this set of opening remarks will be the Ambassador Margorzata Wasilewska, apologies for mispronouncing the name, from the delegation of the European Union to Barbados, the Eastern Caribbean states, the OECS, and we will also be joining later by other speakers, which I will name when we get to that segment. So let's start now with the recorded message from Mr. Dean Chambliss.
Hello and virtual greetings to the representatives of the delegation of the European Union, the CARICOM Secretariat, Global Affairs Canada, UNFPA, PAHO colleagues, and other partners and viewers joining us online. Today, we stand united against a pervasive issue that affects us all: violence against women and girls. It is not just a women's issue. It is a societal crisis that demands our collective attention and action. Every woman and girl deserves to live free from fear and violence. We must foster a culture of respect where their rights and dignity are upheld and protected. However, reality often looks very different. 1 in every 3 women and girls in the Americas is estimated to have experienced physical or sexual violence in their lifetime, mostly by someone they know. We know that violence results in health, social, and economic costs. These include deaths and injuries requiring emergency treatment, sexually transmitted infections, mental illness, and increased risk of non-communicable diseases, as well as the direct economic costs of health services and interruptions to education and employment, as well as reductions in GDP. Up to 66 million women and girls in the Americas are estimated to experience interpartner violence at least once in their lifetime since the age of 15. These numbers are shocking and must change. The burden of violence on women and girls and their families and communities is especially staggering because these costs are preventable. Today's webinar shines a light on a critical aspect of this important agenda: the health system's capacity to respond to violence against women and girls. When a woman or girl experiences violence, it is fundamental that they receive the information, help, and support they need and want. Women survivors often name healthcare workers as the first professional point of contact to seek help from when faced with violence. Health services have the potential to provide a refuge for women, a trusted space to ask questions and receive understanding and help. But this assumes that health workers have the needed information and skills to provide a quality response. This response starts with early identification of at-risk groups to give us the opportunity to intervene before violence escalates. The response prioritizes health workers who can offer first-line support and recognizes that every hour counts in responding to sexual violence, including timely access to appropriate clinical care. This response must foster connections to other service sectors, including legal, social, police, or economic support, to meet the wishes and needs of survivors. To empower health workers to play this critical role, they must be equipped with the appropriate information, tools, and training. They must be supported by a functioning health system, with police policies and protocols aligned with the evidence base of what works, and with referral pathways within and across sectors. In direct recognition of the critical role of health systems in the response to violence against women and girls, in 2015, the governing bodies of PAHO adopted a regional strategy and plan of action on strengthening the health system to address violence against women. This strategy specifically addressed the need for training of the health sector so that every woman and girl receives the care and support they rightly deserve. Today's launch event brings us a step closer to this vision, and PAHO is pleased to collaborate with the Government of Canada and UNFPA under the Spotlight Initiative to launch 3 new courses, the first of their kind, to be available publicly in the PAHO Virtual Campus for Public Health. The great advantage of these courses is that they are self-paced and available online at any time to adjust to the schedules of busy health sector staff. By providing these training opportunities, we are continuing to break the silence about violence against women, challenging harmful norms, preventing violence from occurring, and supporting survivors. Education, empowerment, and equitable opportunities are essential in creating a future where every individual can thrive without fear. PAHO stands ready to work with countries and partners to continue strengthening the capacity of the health sector and its staff on this important topic, to support and expand learning opportunities, and to encourage the exchange of best practices across countries in the Caribbean and beyond. Together, let's build a Caribbean where safety, equality, and justice prevail for all. Thank you.
Great, thank you. And that was Mr. Dean Chambliss, that's the Regional Program Coordinator for the Office of the Caribbean for PAHO. And I did not introduce myself earlier. I am Gloria Geraldo. I am the NCD and Mental Health Advisor for the Subregional Office in the Caribbean for PAHO. And it's a delight for us to be working again, as I mentioned, collaboratively. And we have the privilege of being in the company of Leah Marchuk. She is the Director of Inter-American Affairs for the Government of Canada, who's been an important and unwavering supporter of this work in the region. Please, Leah.
Good morning, hello, and thank you so much for including the Government of Canada in this webinar today, this really important discussion. It's great to be here. I'm going to apologize in advance. I have a bit of a cold and my voice is a little bit going, so I'm going to do my best to speak clearly this morning. So first of all, thank you very much for having me. Again, I'm the Director of Inter-American Affairs here at Global Affairs Canada, and the Government of Canada is absolutely thrilled to support the launch of these important online training tools aimed at building health sector capacity. Canada extends its gratitude to PAHO for its tremendous leadership in combating discrimination and violence against women and girls in the region, emphasizing the importance of upholding and promoting their sexual and reproductive health and rights. Violence against women is not just a violation of human rights, it's an issue that impacts us all. Our communities and societies suffer when individuals experience violence, and we all share the responsibility to ensure that women and girls enjoy the respect, protection, and freedom that is rightfully theirs. Canada remains steadfast in championing human rights nationally and internationally. Our advocacy extends across multilateral fora and individual engagements, ensuring a commitment to the promotion of human rights. Canada, through its public health agency, is proud to have contributed close to $200,000 in 2022 to help PAHO strengthen the health sector's response to violence against women and girls in the Americas, with a specific focus on vulnerable groups. Since the launch of Canada's Feminist International Assistance Policy, our annual investment in international assistance related to sexual gender-based violence has tripled, reaching $88 million in 2021 and 2020 and 2021, excuse me. This includes Global Affairs Canada's $15 million contribution to the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project with PAHO in the region. We appreciate PAHO and the WHO's dedication to integrating a gender perspective into health research, program and policy development, and the promotion of gender equality in health. We hope these tools, in combination with PAHO's leadership, will help provide key health workers and stakeholders with the necessary means to tackle the issue of violence against women. Thank you very much, and I look forward to hearing more about these online tools.
Thank you. Thank you so much, Leah. And thank you for your support and the support of the Government of Canada for all of these efforts. Well, we will now jump into our first panel of this morning. We wanted to design a very dynamic webinar and basically allow for conversation that it allows the panelists to express perspectives. And our first panel of this morning is composed by regional organizations and international organizations working collaboratively in this area. And so we like to ask our participants of the first panel that is composed by the UNFPA's Director and Representative for the Sub-Regional Office for the Caribbean, Elizabeth Talbert. We also are accompanied by Tamara Bob, the Program Manager for CARICOM Health Sector Development, and by our very own Silvana Luciani from PAHO, Unit Chief of Non-Communicable Diseases, Violence and Injury Prevention. We have one question, and we would like for each of our three panelists to share perspectives from where they stand on why capacity strengthening for the health workforce is important in this area, responding to violence against women and girls. So we will start with this question with Elizabeth Talbert from UNFPA. Elizabeth?
Elizabeth, you're muted. Betty, you're muted.
Okay. Hi, good morning. Happy to be here for the launching of these online courses. As the United Nations Population Fund, we're delighted to have collaborated with PAHO in developing one of the online courses launched today, that will be launched today. Specifically, we worked on the training on strengthening the health sector capacity to prevent and respond to violence against women in the Caribbean. This course is specifically designed for policymakers in the Caribbean to build their skills on public health approach to prevent and respond to violence against women and girls. For UNFPA, capacity strengthening of healthcare providers is core to our mandate. The current UNFPA strategic plan for 2022 to 2025 reaffirms UNFPA commitment and calls for urgent action in ensuring universal access to sexual and reproductive health. It focuses on critical pathways and the strategies necessary to accelerate the achievement of three transformative results, which are ending the unmet need for family planning, ending preventable maternal deaths, and ending gender-based violence. In the area of gender-based violence and prevention, we have traditionally worked with UN sister agencies in building capacity in the health sector, ensuring healthcare providers have the required knowledge, skills, and attitudes to respond to gender-based violence. UNFPA employs a multi-pronged response to strengthen the capacity of healthcare providers. And this response looks mainly at pre-service training, in-service training, and online courses. The pre-service training, where we worked with the learning institutions, midwifery schools, and other learning institutions to ensure that the curriculum is updated and there is focus on gender-based violence response within the health sector. The in-service training, since we are aware that health is dynamic, it's a dynamic field and emerging issues and technology, this requires a continuous capacity building of healthcare providers to ensure quality care. UNFPA has been supporting development of training materials and conducting training for health workers. These include clinical management of rape and intimate partner violence, as well as referral pathways for GBV survivors. And then, of course, the third prong, online courses to expand the learning space. UNFPA have been developing online courses for healthcare workers. The one we are launching today is a good example. So I would like to conclude to restate that capacity building of healthcare providers is core to our mandate of providing universal access to sexual and reproductive health. We have worked closely, as I said, with PAHO and other UN agencies at the global and regional level as the lead UN agency within the health sector in terms of setting norms and standards. We look forward to further collaboration in this area of capacity strengthening. Thank you very much.
Thank you so much, Elizabeth, for reminding us and giving us the perspective of that multi-pronged response to the training of healthcare workers and the details that you have provided. We have the privilege of having been able to connect with the EU ambassador for the delegation to Barbados, the Eastern Caribbean states, and the EU OECS, Ambassador Wasilewska. Please, I know you have a few words to share with us. Please kindly do so.
Thank you so much. I will be very brief because when I listen to the opening interventions, I think majority of the main issues have already been covered quite comprehensively, and I don't want to be just one of those speakers that keeps repeating what others have said already. So let me just say that I'm extremely excited that this training opportunity is being made available. EU is very committed to addressing the root causes and the impact of gender-based violence against women and girls, but also family violence. Our Spotlight initiative, I think, is pretty well known in the region, and we're very happy to work with all the partners who are involved in this. We recognize also that occurrence of family and particularly gender-based violence is a massive impediment on economic activity anywhere in the world. Because you basically switch off, disconnect those women or those girls from any possibility of economic activity. So therefore, it also has a very negative impact on development, not to mention, of course, that it's a massive infringement of their personal, of their rights as human beings, their human rights, and something that marks them and scars them very often for life. The role of the health workers in that process is a critical one, because very often, even when there is a huge pressure by family and by the community on women or girls not to report, not to shame the family, not to disclose the perpetrator, they do end up seeing health workers because they need medical advice or because they end up being pregnant as a result of the abuse. And the health worker will always walk a very difficult, very delicate line where they often see and they're convinced and they see evidence that there is abuse, that it's not a result of a regular accepted relationship where that a teenage girl becomes pregnant with a frequency that is suspicious and where there is no regular partner. But this line of what you can and cannot do when the victim does not want to report, does not want to disclose the perpetrator is a very difficult one. And I recognize and I have full empathy for the health workers who often have to protect the privacy and the right of the victim to remain silent. However, there is room not only for collection of evidence, but also for counseling and additional services that can be made available to a particularly vulnerable young girl that may help her come to the understanding that her rights have been violated, and therefore it is worth to pursue their own mental and physical well-being. And perhaps that is more important than protecting the shame, if you like, or the reputation of the family or the community. So this is recognizing that addressing the issue effectively requires a multi-sectoral approach. So the health worker that is well trained can understand very well what are the best modern practices in providing the care, in referrals, in accessing other services, preserving the evidence for potential pursuit of justice, if not today, maybe tomorrow, maybe in a couple of months' time, or maybe even later. And I think we've made progress, but there is, particularly in the Caribbean, still a lot to be done for the girls to actually understand that they have a right to integrity, that their bodies should be untouchable, and they have a right to protection and support if they're unfortunate to become victims. So I'm very excited. I hope the course will be accessed by many health workers and will hope to make a difference in the region. Thank you.
Thank you so much, Ambassador Wasilewska. You really bring also that human perspective and some reflections about the women and girls who will benefit from the having healthcare workers that are sensitized, well-equipped, and well-trained. Thank you so much for those words. And now we would like to continue also with our next guest who represents CARICOM, Ms. Tamara Bob, who is the Health Desk Manager, and for whom we, in this conversation that we're having, wanted to also revisit this question of why strengthening the health sector response is important to the countries, to the healthcare workers in the CARICOM community. Over to you, Tamara.
Good morning to you, Gloria, and to the other esteemed panelists, and to those who have joined us virtually. I'm pleased to bring you greetings on behalf of the CARICOM Secretariat, and thank you for the opportunity to be part of this occasion. I also wish to commend PAHO and the UNFPA on this collaboration, and the Canadian government and the Spotlight Initiative for supporting the development of these 3 virtual training courses that aim to build the health sector capacity. As mentioned earlier, the issue of violence against women and girls is a deeply concerning problem, and it has implications for public health in the region. So just to touch on why capacity building of healthcare workers to address the issue is important to CARICOM. One is that we have the CARICOM, the Caribbean Roadmap for Human Resources for Health, 2018 to 2022. This document emphasized the significance of quality education in developing competent healthcare workers that are equipped with the necessary knowledge, skills, and attitudes to deliver quality care. And this is particularly important as many of our health systems are transitioning to a more community-based primary care, where the healthcare workers may need additional support. And the courses that will be launched today are important to CARICOM as they promote standardized approaches to public health issues, such as violence against women and girls. The resulting consistency in knowledge and practices among healthcare workers and other stakeholders will contribute to reducing disparities in healthcare quality and access, and it also supports the overarching goal of universal health coverage in the region. Additionally, health professionals, doctors, nurses, and other staff are in a very unique position to recognize the signs of violence against women and girls. And these may range from physical injuries, they may present with psychological distress or any other indicators of abuse. So providing training and resources to health providers can allow for early intervention and support for survivors. And this in turn improves the overall public health within the region. Additionally, our healthcare workers in the region have legal and ethical responsibilities in relation to effectively responding to cases of family violence. So capacity building that not only includes what to look for and where to refer to next, but also includes ethical consideration, including performing these roles in a way that is sensitive and confidential, while at the same time ensuring that the legal and forensic aspects of the response are handled appropriately, is important to our healthcare workers. And another reason why capacity building is important for healthcare workers in the region, our previous speaker just mentioned, is that it enhances multi-sectoral partnerships. Coordination, collaboration are very important, working together. This, like many of our health challenges, is a multifaceted problem that requires several stakeholders working together. The health sector cannot address the issue of violence against women and girls on its own. There should be collaboration between the health sector, law enforcement, social services, education, and community-based groups to explore how they can address the root causes. The capacity building initiatives like these that emphasize collaboration promote multi-sectoral partnerships and coordination in the CARICOM member states. And as we saw during the COVID-19 pandemic, collective action between health and non-health stakeholders really enhanced our response. Before I wrap up, I would also like to add that there is also the plan of action on human resources for universal access to health and universal health coverage 2018 to 2023. And this also speaks to interprofessional teams and upgrading the skills of every individual and every team through opportunities for continuing education in health. And so courses like these, for instance, the training on medical legal response to intimate partner violence and sexual violence, it not only addresses the clinical management of rape and sexual violence, it's not just for health workers, but it provides resources and training to other stakeholders to allow for appropriate management of the legal and forensic aspects. So once again, we want to commend you, our valued partners, on the development and launch of these courses, and we anticipate positive outcomes for the health sector at the national and also at the regional level. Thank you so much.
Thank you so much, Tamara, and thank you for bringing up important aspects, especially about the intersectorial approach. And this is what this webinar also represents. And it's really the culmination of those intersectorial and interagency collaboration that brings us here today. And precisely, we want to bring our own PAHO representative, our unit chief from the Non-Communicable Disease, Violence and Injury Prevention Unit, Ms. Silvana Luciani. Please.
Great, thank you. Thank you so much, Gloria. And it really gives me a lot of great pleasure to join all of our colleagues from the EU, from the Canadian government, UNFPA and CARICOM, together with our leaders in the ministries of health from the region, from Jamaica, Trinidad and Tobago, and Grenada, to commemorate the 16 days of activism against gender-based violence. And with so many of you, over 200 connected virtually to our webinar. And we're really, really pleased to launch these new courses. And as we've heard, the 16 days of activism are really a good opportunity to raise awareness and to strengthen that collective commitment that we have across all the agencies in the UN system, with civil society, with governments, against gender-based violence. And from PAHO, we're particularly excited to highlight that health sector role to gender-based violence and to show our commitment by building healthcare capacity by launching these 3 new courses. One is on healthcare support for survivors of gender-based violence, another on public health approaches, and another on the medical legal responses. And you'll hear more about the courses in the next presentation, but I want to get to the question, Gloria, that you've posed to us as panel members on why is capacity strengthening for the health workforce important to us? And I would say from PAHO's perspective, in short, it's because it aligns really well with our mission and our focus to strengthen health systems in the Americas. And strengthening the health workforce capacity is a major input. It's one of the inputs to health system strengthening. And then in terms of the specificities around violence against women and girls, I would say there's 3 main reasons why capacity strengthening for health workforce is important. The first is around the tremendous need that we know exists for training of this sort. Secondly, the demand that we receive from healthcare workers as well as governments for training in this area. And third is the mandate that our governments in the Americas region have given to PAHO for health system strengthening and training providers. So I just want to delve into a little more deeply on each of those 3 points. So for need, we know and we've heard that women survivors themselves often name health workers as their first professional point of contact to seek help when faced with violence. So women really need the health services to be responsive, to provide that place of support and refuge and a safe space and a trusted space for them to ask questions, to receive care and support in the response in the immediate aftermath, but also as we know that there's long-term consequences over time and providing that continuous support and continuous access to services. And we know that health workers, when they are able to identify those at-risk groups early, when they can provide that quality and responsive care tailored to the needs and preferences of women and girls themselves, that it can intervene before violence escalates, and it can help mitigate the impact of violence on health and well-being, and especially mental health of women and girls. And this is only, of course, possible when you have a very well-trained and engaged and skilled workforce. And of course, training is not just for the primary care providers or that first point of contact in the emergency unit. Training is also for the policymakers, the health leaders, the health authorities in the government, because within a government's health system, or even with civil society health system support, you need that leadership and that mentorship and support so that there are evidence-based health policies, that there's a health system infrastructure to ensure that there's quality of care that is able to be provided by the health providers themselves. So the need is clear. And then on the demand side, we experienced during the COVID pandemic an exponential increase in gender-based violence, unfortunately, and this resulted in an increase in demand from health workers and health authorities, just seeking that technical assistance from PAHO, from our UN agency partners, from civil society groups, for more information, for more training and resources on how to respond to that escalation in gender-based violence. So these 3 new virtual courses that we're launching today are a direct response to the requests that we've received for support from across the region, and we hope that it'll help complement the work that PAHO is already doing with countries through our workshops and country missions or our regional trainings, in-person trainings, but that the virtual platform through the PAHO Virtual Campus on Public Health, which reaches millions and millions of primary care providers and beyond, that we hope that this platform really extends our work beyond our in-person training. We know that there's about 34% of women aged 15 years and older who experience physical or sexual violence. And we also know this is probably just the tip of the iceberg, that there's many more. And this translates to millions of women and girls who need that care and that support that is offered through the healthcare system. So these courses, we're hoping to reach those thousands and thousands of healthcare providers that we know are needed in place in the health system to provide care for those women and girls. And from PAHO's perspective, we're really grateful to have the collaboration and support from the EU Spotlight Initiative, the support from UNFPA, from CARICOM, and especially from the Government of Canada for making all of this possible through technical assistance and financing. And I just want to conclude on the third point around the mandate that's given to PAHO by our member states. We really feel proud that through the PAHO Directing Council, which is composed of ministers of health from across the region, that we were the first in 2015, so 8 years ago, to adopt a regional strategy and plan of action on strengthening the health system response to address violence against women. So this is a clear role for PAHO, and to work closely with our member states to help ensure that there's a well-equipped and well-skilled and competent workforce to address the needs of women and girls who are survivors of gender-based violence. And PAHO stands ready to work closely with all of our partners to roll out these excellent training opportunities and really build that capacity and skill. So stay tuned to learn more about the courses and how to access them in our next presentation. Back to you, Gloria.
Thank you so much, Silvana, and thank you for just laying, very, very explicitly a response to the question of why, and really reminding us also where this has been a problem, how it was exacerbated during the COVID-19, and we might tend to forget very quickly, but this is also a very, very important aspect, and to which this set of courses are responding so swiftly to the needs. So now we are so excited to move into the next panel, and we want to thank the panelists of our first session of the webinar, our collaborative, our organizational partners. We would like to move to country representatives, and this is really where the work happens. This is exactly the people that are in front of the woman or the girl who unfortunately has been a victim of violence, or is in front of those healthcare workers that will be very directly dealing with the circumstances, the unique circumstances of each woman and girl. So we are very happy to have representatives from Grenada, Jamaica, and Trinidad and Tobago. We're going to go ahead and start with a round of first questions for our panelists. And let me also name our panelists. I know they'll have the opportunity to, if they want to briefly also introduce themselves, but we have from Grenada, Ms. Nestor Edwards, who is a community health nurse. From Jamaica, we have Dr. Tamu Davidson, who is the Director of NCDs and Injury Prevention. And from Trinidad and Tobago, we are accompanied by Dr. Surjan Singh and Dr. Sukhu, and we will be having the opportunity, again, we wanted to create a space for conversation. So let me start. This is the order in which I had the country. So I'll start with you, Ms. Edwards. In your opinion, why is capacity building in the health sector so important? And as you think back, you may want to describe what is being done in Grenada at either at the national level or the institutionalization of national protocols that have been developed to guide the work in the health sector. Over to you, Ms. Edwards.
Good morning, and thank you for having me. I am seeing that Zoom is unable to detect my camera, and I apologize for that. But it's a pleasure for me to be on this this Zoom meeting this morning, and the strengthening of capacity building among health workers is very, very important for us in Grenada at this time. In fact, yesterday we started a training program for healthcare professionals, on gender-based violence. Today we are looking at the standard operating procedures that governs healthcare professionals. And tomorrow, please God, we'll be looking at the clinical management of rape, And so we have healthcare professionals from both public and private sector. We also have them comprising of nurses, doctors, laboratory workers. We also have our health promotion officers being a part of it, the training this morning. It is important to build the skills, the knowledge, skills, and competencies of our healthcare professionals to deliver quality care to survivors / victims of gender-based violence. I must say that in 2020, through support of PAHO and the Spotlight Initiative, the Ministry of Health, Wellness, and Religious Affairs embarked on the review of its standard operating procedures for healthcare professionals. A desk review was conducted. There were key stakeholders interviewed, and subsequently the document was revised. It was later taken to cabinet, where it was approved in 2021 and launched in December of 2022. Since then, there has been focused training for healthcare professionals and also other service providers. And by that, I mean the police, the justice system, there have been focused training at the parish level, right? Going through each of the parishes and training, persons. A multi-stakeholder approach was adopted, and as I mentioned, today we are delving into the standard operating procedures for healthcare professionals. And those SOPs are based on the principles, the guiding principles of respect and protection of human rights, non-discrimination, informed consent, do no harm, self-determination and participation, confidentiality, and the rights of the survivors or the victims to privacy. Safety and security is a big concern for us. Adopting a survivor-centered approach and promoting that multi-sectorial orientation is also an important approach that we have adopted. In terms of children, we want to stress the importance of having or putting the best interests of the child at first, So we have been doing quite a lot here in terms of strengthening, our human resource for health, ability, and capacity to respond appropriately to cases of gender-based violence. Thank you.
Thank you so much, Ms. Edwards, and what a refreshing voice to hear from you as a community nurse and to hear of the work being carried out. We will now move to our colleague from Jamaica, Dr. Tamu Davidson, and it's a pleasure to have you. We want to visit with you. It's a similar question, as the conversation as we were sitting around a coffee table. It's similar. We continue along the same lines, and we would like to hear what has Jamaica done to strengthen the capacity of health workers on this area. Feel free to describe any efforts around training, methods, and its rollouts at the regional and local levels. Over to you, Dr. Davidson.
Thank you for having Jamaica here and participate. And certainly it's a pleasure to represent the thousands of healthcare workers and other stakeholders who have been working towards addressing violence against women and children and violence in general in our setting. So in Jamaica, we have had a long history of capacity building around violence against women and children. And in fact, we have a national framework, but within the context of the health sector, our first policy was the policy for the promotion of healthy lifestyles in Jamaica, 2004, which included an integrated approach, but also an approach addressing injuries prevention and violence against women and children in the school, workplace and home setting, led by and driven by the Ministry of Health and Wellness. And the primary focus was about addressing youth and adolescents, and also really addressing sexual assault. And so that was followed by our what we call our guidelines or protocols for the management of sexual assault, which primarily focused on children, and training and capacity building in that area. And then we followed with the National Strategic Plan for the prevention and control of NCDs in Jamaica, which set up a framework again for addressing injuries prevention and injuries management. And within that context, formed the framework for putting in our protocols and guidelines to address violence against women and girls. And this included the development of an interpersonal violence guideline and protocol, and also our new draft guideline for gender-based violence, as well as also other guidelines, such as guidelines for suspected trafficking, and also updating our sexual assault manual. So we have 4 protocols that we have been using to guide our service delivery over these couple of years. Most recently, using these particular protocols, we did quite a bit of training and capacity building. Initially, that was face-to-face from 2018, and then we moved to 2022 or earlier with, well, in 2019, we joined with the Spotlight Initiative, where we began to do capacity building around gender-based violence. So we have and addressing violence against girls and women. So we have worked with the Spotlight Initiative to last year develop a program jointly with PAHO and the Spotlight Initiative online to train persons in gender-based violence. And we were able to train 16 trainers and also to train healthcare workers. This particular platform allowed for us to reach more persons, as it was a virtual training where persons could utilize their own time to do this capacity building. Along with the training, we also have been rolling out our protocols around interpersonal violence and doing training around that. In addition to that, we have developed monitoring tools to also audit and assess whether these services are being delivered as planned, and also to assist our healthcare workers in improving these services. So along with the protocols and guidelines, we have assessment tools, and also we have been doing public education within the public setting and also within the healthcare setting to improve awareness about these protocols, but also about these guidelines. So we've reached recently, we have actually looked back at the approach we have been taking. And as you can see, we have multiple guidelines. And so this could become very overwhelming for the health system. So one of the approaches we have done is to now have an integrated, comprehensive approach to this capacity building and training under the umbrella of the interpersonal violence guidelines, so that we have a more coordinated approach. And we work with our regional health authorities, and we have targeted groups both in hospital and primary care setting. And we've looked at right throughout the healthcare gamut. So from our orderlies to our community health aides, our patient care assistants, right up to our physicians or pharmacists, have been trained in really delivering this protocol. So in essence, what we have been doing is really reorienting our healthcare system. And this is all a part of our national strategy for primary healthcare reform, and also our national strategy for addressing injuries in the healthcare setting, working in collaboration with many of our partners in Ministry of National Security, and of course, PAHO, UNFPA, and the Spotlight Initiative. We also work very closely with our HIV partners as well, and are supported through Global Fund. This is an ongoing process. This year, we targeted over 200 healthcare workers, and we use a hybrid approach. So part of it is self-directed learning, online, and also face-to-face in rolling out. We just completed rolling out this first phase of capacity building. And so this will be an ongoing process. We also have job aids to help facilitate the process as well in our capacity building efforts. And we have been also working jointly with other partners for them to understand, with this multi-sectoral approach, the role of the health sector. So really taking this as to a next level, a whole of government approach, and taking it right down to the community level at the level of the health facility. And so we hope to assess this and evaluate how well this approach and methodology helps us to move towards having a health system that's proactive, that's patient-centered, and meets the needs of our clients. In addition to that, we are also integrating approaches to integrating it in other programs, taking a life course approach in order for us to also do the prevention component. So one of the things you asked earlier on, why is it important for the health sector? Health sector is where thousands of people come, and there's an opportunity right throughout, from pregnancy, right throughout each aspect of the life stages, to intervene and to get persons aware of and build capacity for self-resilience and also self-management, as well as it relates to preventing violence and also identifying cases of violence and intervening. So that will be our contribution for this time. Thank you for having us today.
Thank you so much, Dr. Davidson. And that was really comprehensive. So thank you very much. And in the interest of time, I will move on to our third panelist, who is from Trinidad and Tobago, from the Office of the, he's the director of the Directorate of Women's Health. And he is helping me in the pronunciation. Please forgive me, I'm still going to try it. Dr. Surjit Singh, and we're delighted to have you. We'd like to explore, you can answer similarly as other countries, but also if you like to infuse a bit of how you're looking at future priorities for strengthening health sector capacity to respond to violence in Trinidad and Tobago, and how do you see the online courses and other tools that by PAHO, UNFPA, and other partners help you with this in your mandate? Over to you.
Okay, thank you very much, and good day to everyone on this Zoom platform. So my colleagues, of course, from Grenada and Jamaica have really shared similar sentiments and issues that we across the Caribbean share. And we're delighted, of course, after this to meet up with them and share some similar experiences. So I'll answer the first part of the question slightly different, and using an example of my team, which were formed. We're called the Directorate of Women's Health, and we were formed in Trinidad and Tobago in the year 2017. And our mandate was really to build capacity and to improve the health of our mothers and newborn babies. So the government mandated us to formulate policies and implement programs to address these issues. And we are reaping some of these successes by forming policies. So for the period 2018 to currently, Trinidad and Tobago has attained those SDG 2030 targets for both maternal and newborn mortality. Now, part of that success story was, of course, as I said, all of these numerous policies and clinical guidelines. They contribute to the improvement of the lives of our population. When it comes to violence against women and girls, now this was not an area under my personal or my team's expertise. We had to learn a lot. It wasn't covered under our portfolio. However, my department had finalized the first ever national sexual and reproductive health policy in the year 2020. It was therefore only natural that we would lend our expertise to the creation of the first ever national clinical and policy guidelines on intimate partner and sexual violence earlier this year. And this was done through our partners at the Spotlight Initiative and the PAHO and the UNFPA teams and other collaborators. Without their intervention, we would not have had this pioneering document. This document serves as a recipe or a blueprint to address the difficult issues of violence against women. Now, we were able to standardize the system for documenting and caring for our survivors who now encounter the healthcare system in a non-judgmental manner. And for those countries listening in, it is critical to have such a document. It needs to be simple, easy to follow in order to educate our healthcare workers and the support teams. And I would like to say, you can visit our webpage at the Ministry of Health of Trinidad and Tobago, and you can view your documents. We have shared it for everyone to see. You can use this in your countries, you can tailor it. When you read it, you will appreciate that these documents, they reflect evidence-based practices, but they are realistic enough to be achieved based on the resource and other constraints that we all face. The documents are also tailored to ensure they conform to our country's legal framework, as this is critical for stakeholder and political support. With regards to the second question you asked about future priorities and strengthening health sector capacity, we have now created significant momentum on the issues of violence against women in our country in the healthcare sector. Now, in order to sustain these gains, the Ministry of Health now has a database of 156 persons who have been trained as trained trainers, as well as additional healthcare workers who received training, which was led by our consultant, Dr. Caroline Allen from the PAHO team and the Spotlight Initiative. Now, our first approach in Trinidad and Tobago would be ensure that these trainers are provided with resources and the ability to continue to roll these sessions out to more personnel across their regions. Now, my team at the Ministry of Health, we will perform the critical monitoring and evaluation. We will receive those reports, we will assist and ensure there's continuity. Now, I just want to make a plug, as you said, and everyone has said it, the launch of the online courses from the PAHO WHO Virtual Campus. This will make things much easier for us in Trinidad and Tobago. We are one of the countries in the English-speaking Caribbean with the most persons using the virtual platform at this time. I hope none of the other countries pass us, but we are going to continue pushing our healthcare workers. We have all benefited from numerous courses, including those on respectful maternity care, surveillance, COVID-19, just to name a few. So we are going to encourage our local medical training institutes to utilize the platform so that the students as well will receive training during their undergraduate studies. I'm proud to say I actually went on and I actually got one of the certificates already. I did one of the courses, so I did pass. I didn't answer all the questions, unfortunately, correctly, but I was good enough to pass. So this was very helpful. So the critical steps now will include we have actually a digital health module that's coming on intimate partner violence in our healthcare sector. That's the future. This will facilitate easier access to clinical records for those who need to know based on authorization. Within the healthcare system, we can share the information to emergency departments, social workers, counselors. Again, we don't want our survivors to repeat these incidents to the multiple personnel. There's a significant medical legal response, as we said as well. And if so, we can link this information to the judicial and police services. Thank you.
Thank you. Thank you. I've just been so delighted learning so much from the country's experiences. Thank you, Trinidad and Tobago. Definitely. Thank you for sharing that resource. And this is also part of what we wanted to create in this space, the richness of experiences, and that your invitation to share and to cross-fertilize among countries is very well taken. And I hope we can continue that type of exchange in the future. Now, we are coming to the closure of our webinar, and we want to simply provide an overview very briefly from a regional advisor for prevention of violence, Ms. Brita Baer, and we'll close with her brief remarks. Thank you.
Great, thank you so much. And thank you to everybody who participated. I am just going to do a very quick overview of the 3 courses and tell you how to access them. Give me a second to share my screen. Okay. So as you've already heard, we are launching 3 courses today, and these courses are really based on the global evidence base. These are not new topics, and we do know a lot about what works in strengthening the health sector response at all levels. And this is what the 3 courses are based on, the global evidence base. And they've really been inspired by country experiences, including the work in Grenada, Jamaica, and Trinidad and Tobago, as well as many others. And I just want to recognize all of the inputs we received in the development of these courses from various different counterparts and partners at country level, at local level, who have really inspired the content of the courses, and I hope you like the result. As we mentioned, there are 3 courses. The very first one is specifically addressing the medical legal response to intimate partner and sexual violence, developed by PAHO with the support from Canada. And it really targets those medical legal frontline providers, which includes health workers, but also laboratory, legal, justice representatives, social workers that engage. Medical legal responses are one of the essential services in response to violence. And we're so pleased that we finally have a course that will hopefully help build basic capacity. And there you have the registered link. The course is available, and please join and obtain your certificate and adapt it to your country context. The second course is addressing the health sector response, including health care to violence against women and girls. It was developed by PAHO with support from Canada and specifically targets health workers because it deals with basic principles in the response to violence and the clinical management of intimate partner and sexual violence, with a focus on diverse cases. So it includes content, for example, on identification, on first-hand support lives, on mental health care, on sexual violence. And a big bonus, and that one that we're really excited about, and that was really promoted by the countries who participated in the pilot, is that it includes an optional module, which is a training of trainers. Because we not only want this resource to be useful to everybody, we also want you to be able to use these materials, adapt it to your context, and run your own trainings, because this is really an ongoing agenda, and we need more and more people that roll out training and educate others. And who better to do this than health workers and health training officers in countries? So I hope the training of trainers module will be useful, and you can use this information to create and advance this agenda together with us. And this course is also available online in the campus for your use. And the last course is specifically talking about the public health response in response to violence against women and girls in the Caribbean. It is building the capacity of regional, sub-regional, and national health sector actors. It was developed by PAHO and UNFPA with support from the Spotlight Initiative and the European Union. And it really targets health policymakers and health managers at the different levels, because we know health workers in the clinical response don't stand by themselves. and they need to be mentored and supported and advanced through the support of policymakers and actors at the different levels. And this is why this course has been so critical. And we're so pleased to collaborate with UNFPA on the development of this course. The course is being launched as a soft version, which means that you have the chance to try out the course and give us feedback. You will find on the screen and in the chat a link to the course and all of its modules, as well as a feedback form. And we kindly ask you to explore this material and send us feedback. It's really important for us, for PAHO, for UNFPA and our partners to hear from you on how can we strengthen this course to make it even more useful to policymakers in the Caribbean at all levels. So please join us and provide us your feedback and provide us your comments so we can make sure it meets all of your needs. So just to recap, the links to the courses are available. They're free, they're available, and you need an internet connection. But beyond that, you should be able to access them. Feel free to contact any of us if you run into any trouble. They're self-paced, so you can come back to the material at any point, and they offer a certificate on completion of the assessment. They all align with global, regional, and sub-regional mandates and the latest evidence base of what works. And together, they really create that first-time package that is needed to strengthen health sector capacity and hopefully help to respond to, mitigate, and prevent violence against women and girls and all the diversity. So please click on the links, explore the material, and make use of them in your contacts and adapt them as needed. Thanks so much. Over to you, Gloria.
Thank you so much, Brita. And this really brings us to the conclusion of our webinar. We hope you've enjoyed it, but more importantly, we are really inviting you to continue to co-create with us. So the invitation from Brita to review with the links provided that have been also shared on the chat several times. You can scroll up and you will be able to find them. Please, if this is an area that you're passionate about, your perspective and your opinions are very valuable to help us finalize the course that Brita described. The others are ready, as you was shared by our colleague from Trinidad and Tobago, who has passed his own course. And thank you. There's only, we have gone over a little bit, but just extending our thanks to the Government of Canada, to, of course, our close, our partners, UNFPA, to the European Union, to everyone who's made this possible. They are behind this work under the leadership of Brita and others, many consultants and many others working and contributing to make these courses relevant and successful. So thank you for accompanying us, the 200 of you that have been throughout today's webinar, and please continue to join the 16 days of activism against gender-based violence, which is, we know is not just 16 days, but is an entire year of work. So thank you so much and have a wonderful rest of your day. Thanks.